Hi and welcome. My name is Mia Keeys, and I'm so very excited that you're joining us today as we discuss Knowledge is Power, how federal policy can impact uterine health. I join you as the Director of Federal Affairs for Hologic, which is a women's health and innovation company. And we're here today to talk about a really very significant issue that impacts women all over the world, that impacts people with a uterus. If you have a uterus, one can acquire potentially fibroids. And so we want to make sure that no matter what, you leave this conversation with two things at top of mind. One, you yourself are someone who needs to be mindful of uterine fibroids, whether or not you have a uterus, because likely you love someone who does. And two, you're going to leave with a better understanding, a greater appreciation of how to move the federal policy needle in order to advocate and change the lives of people who are currently in your life, as well as those who are coming down in future generations. And I'm not going to be here myself talking, but we are joined by really very significant people. One, we're joined by Ms. Nisha Thanawala. She serves as the Senior Policy Advisor to Congresswoman Yvette Clarke, who is one of the principals of a very significant piece of federal policy around uterine health. And Nisha leads the Congresswoman's work on healthcare and also specifically on women's health issues. So in advance, I offer my thanks and gratitude for Nisha being here today. We also have joining us today, Ms. Tanika Valbrun, who is the founder of the White Dress Project. Now, Tanika has been committed to this nonprofit organization for countless years. And through her work, she's able to uplift and spread global awareness about uterine fibroids. And she does so through in a very unique fashion. And she herself has also been instrumental in moving the needle with respect to federal policy. And so we're really glad and grateful that Tanika's here today. And then finally, certainly last but not least, someone who is really very significant to this conversation, we have Ms. Sateria Venable, who is the founder and CEO of the Fibroid Foundation. Now, Sateria has been a patient advocate and researcher for uterine fibroids since 2007. She herself is going to tell a bit about her own story, her own connection to uterine fibroids. But through her actual work, her impact is significant. The foundation supports women across the world in 135 countries and counting. And they predominantly do so through providing education about menstrual health, about uterine health. And what I'll share before I then actually invite Sateria to give us a bit more information about what uterine fibroids are, I do just want to share a bit of a personal hook. Today is significant not just because of this conversation and the work that I do professionally, but I have a friend, a very close sister friend, who is going through right now, as we speak, a hysterectomy because of her own pains associated with fibroids, which she's been battling since we were in college, however many years ago that was. And fortunately, because she has wanted children, she has had her children. But it goes without saying that not only has her health been affected, but her livelihood has certainly been affected by the pains of uterine fibroids. So I send much love out to her and hope for safe recovery. And I hope that you all will uplift her in your spirit and in your mind today. But I want to open it up, as I mentioned, to Sateria and invite her to tell us a bit more about what uterine fibroids are before we get into a conversation about how we can move the needle.
Greetings, Mia. Thank you so much to you and the Hologic team for having me today. It's an honor to be able to speak with your community.
It's an honor to have you here.
Thank you. Next slide, please. I'm going to share with you a little bit about fibroids, but before I start, I just wanted to share that I've had 4 fibroid surgeries. I started the Fibroid Foundation because I couldn't believe that I was unable in a major metropolitan area to find a fibroid specialist. And because of the suffering that I was experiencing, I started speaking with other women and found out through the statistics how incredibly common uterine fibroids are. So you might be wondering what fibroids are, because like me, before I was diagnosed, I had no idea. I had never heard the word. Fibroids are non-cancerous growths of the uterus. And I prefer the word non-cancerous as opposed to benign, because fibroids are far from benign and they've been described as benign for many years, but they can cause significant symptoms. They're the consistency of a golf ball. So imagine having one or several golf balls in your abdomen, pressing on your internal organs and causing immense pain. And they can be the size of a pea to larger than a watermelon. There are several fibroid types, which you see in the graphic here. And intramural is probably one of the most common, which is fully inside the uterine wall. Submucosal is when the fibroid bulges into the uterine cavity. These fibroids can cause significant heavy menstrual bleeding because it causes the blood vessels to expand. Subserosal are fibroids that bulge outside the uterine cavity. And pedunculated, you might think that a small pedunculated fibroid would not be a huge issue, but I had a 2-centimeter one that caused me to hemorrhage for 2.5 months and really tanked my hemoglobin level, which is the level of blood in your body, to about half of what it normally is supposed to be. And the symptoms of fibroids can include, and this is by no means a conclusive list, but heavy menstrual bleeding is a very common symptom, and significant anemia from heavy menstrual bleeding is a serious problem, which can cause the need for transfusions, et cetera. Referred pain is something that I feel a need to touch on because sometimes uterine pain is visualized as contained within the uterus itself. Referred pain is where the uterine pain can cause transverse pain throughout the abdomen, down the legs, up the back, and it can be incredibly debilitating. And then there are bulk symptoms just due to the size of your uterus as the fibroids may grow. It can cause leg pain, it can press on internal organs and more. And here we show a photo of one of our ambassadors undergoing a surgery where a huge, as you can see, mass of fibroids was removed from her successfully with her keeping her uterus. Next slide, please. So 26 million women of reproductive age in the US have uterine fibroids, and that number is staggering. More than 70% of all women of all races get uterine fibroids. And I included these statistics from actual data so that you could see the prevalence of uterine fibroids and how they impact women of every walk of life, every economic status, and to emphasize that this is really due to the impact on an enormous public health issue. And I feel that women should be commended but not expected to suffer through symptoms at work, which they often do. Next slide, please. Health disparities in the United States are a significant issue, and we are really focused through the bill work in trying to overcome these disparities. The economic burden can be $7 to $34 billion annually, and we are working very hard to try to ensure that the disparities associated with uterine fibroids can be overcome. Mia, back to you. Thank you for having me.
Sateria, thank you so much for that really very vivid description of what uterine fibroids are and how they impact people's lives. I want to invite Tanika to give us even more of a vivid appreciation for how uterine fibroids impacts or presents challenges in women's everyday lives. Tanika.
Hi, Mia. Thank you so much for having me. Thank you to the Hologic team. I always think that these are very important conversations that we can have just so that we continue to spread awareness of how impactful fibroids can be on a woman's quality of life. Thank you to Sateria for giving that comprehensive overview. I'll just speak from, the person who is living with uterine fibroids. And, they always talk about location of your fibroids being so important. And that can really impact your symptoms. And for me, you know, I had fibroids in the muscle of my uterine wall. So that caused an extreme amount of bleeding. It caused my belly to bloat every month. It caused me to have frequent urination, some of the symptoms that Sateria talked about. And it overall impacted my quality of life and my mental health, which I think is something that we should be talking about a little bit more when we're having this conversation, that there's something to be said when you are bleeding multiple days in a row. You always appear as if you are pregnant. You always have to go to the bathroom. You can never wear white clothing just because of, you know, you don't feel comfortable doing so because you're afraid of having an embarrassing accident. So all of these things are really impacting quality of life and have impacted my quality of life. Another thing that you know, is sometimes missed in the conversation is the impact that this can have on fertility and your hopes and outcomes regarding being a mother. So these have all been my stories, unfortunately, these scenarios of the symptoms, plus the impact on my mental health, plus the impact on my fertility. So, you know, the conversation around quality of life and not normalizing these symptoms, I think is vital.
You said a full word there, Tanika, and I just want to briefly summarize. You're not just talking about a very localized pain. Sateria isn't just talking about a very localized pain. We're talking about impact on the way we can potentially see ourselves with respect to mental health and the way we can show up in our day-to-day, our day-to-day responsibilities. It
Absolutely.
impacts potentially our relationships, especially if you wish to partner and either conceive children yourself or make decisions, that have economic implications on conceiving in other ways. These are really, this is why it impacts everybody, right? Not just people with a uterus, but every single person. And I really appreciate both of you just laying that out. I want to invite Nisha into the conversation, and I'm sure the two of you have some overlap in terms of how you'd like to discuss the bill that you both have been champions on. Nisha, your boss has been a champion in the uterine fibroid research space. In fact, she's got a Uterine Fibroids Research and Education Act. I'm wondering if you can tell us a bit more about it, about what it outlines. And particularly harkening back to Sateria's words and to Tanika's words, this impacts 70 to 80% of women across the US. That is truly remarkable. So I want to give you the floor, Nisha. What do we need to know about the bill? Why is it so critical that it passed this year? And what does the audience need to take away in terms of being advocates?
Of course. Thank you so much, Mia, for having me here, and, to the whole Hologic team. With White Dress Project and Fibroid Foundation, we have these great advocates on the ground who have been, very vocal about, uterine fibroids, and, they brought it to Congress. And, this we recently reintroduced this legislation, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act, about a couple of weeks ago. In this month of July, we didn't wait 7 months just to introduce it, but it's because it's Fibroid Awareness Month, and we wanted to kind of make sure that it's emphasized that if uterines are at the forefront of everyone's minds in Congress. The bill was named after the late Congresswoman Stephanie Tubbs Jones of Ohio, who was the first Black woman to chair ethics committee and a champion on women's health issues during her tenure. This bill would increase and allocate research funding for uterine fibroids, improve awareness and training, and seek measures to measure costs to government payers. Specifically, it would establish new research funding through the NIH, totaling $150 million over 5 years. It would expand the CMS database on chronic conditions to include fibroids, and direct HRSA to develop and disseminate fibroids information to healthcare providers, and create a public education program through the CDC. It's important that we pass this as the longer we wait, the more women are being misdiagnosed, which in the long run is affecting their overall reproductive health. Also, we are concerned with, the recent Dobbs decision on abortion rights. Women's reproductive health has already been under such scrutiny, and we fear that, misdiagnosis of fibroids can put women in danger. And we think that this is something that needs to be brought to the forefront, that, we need to tackle this now. Like you said earlier, if you have a uterus, you could have fibroids, and, misdiagnosis and not having your own provider that you trust, not knowing what you're going through, is already misinformation and not the press diagnosis that you need. So we believe that we need to pass this. And also, this is something that is very near and dear to my Congresswoman as well. She also is a fibroid survivor and has gone through this in her journey. But so we're here, and this is our biggest priority, that we want to push this forward.
I mean, I wanted to just reemphasize that, Nisha. Thank you foremost for laying that out. And for a member of Congress to herself be a survivor of fibroids, can you imagine, what it takes to be helping to run our nation and to be experiencing, pain, but then beyond the pain, to be thinking about the ways that it's impacted her own life, right? And still do the work on behalf of the people. That's powerful. And it's such an incredibly powerful way to honor also the late Stephanie Tubbs Jones through this bill. And then to make sure that this conversation is talked about in a way that centers everyone and within the narrative. And as you've laid out, I want to go back to one of the things that you mentioned, Nisha. You talked about a provider relationship, essentially. And Tanika, I want to draw you into this conversation. We know that 2 in 5 women go and see a provider. They have a provider, and then they will go and see a provider. But even upon presenting for services and maybe expressing that they're experiencing pain and bleeding, they still may not be diagnosed properly with fibroids, and their pain may be written off. I'm wondering if you can tell us a bit about what we can do to increase awareness, increase belief around people with a uterus and the pain that they feel. How can we help providers to become a lot more sensitized to this? And Nisha as well, what can we do from a policy perspective to make sure that women are adequately prepared and educated about the condition, as well as their treatment options?
Yeah, thank you for that, Mia. I mean, I think it's such an important question, and it speaks to the heart of what we try to do at the White Dress Project, is to strengthen this physician-patient relationship, because it is a relationship, right? We have to feel like we trust our providers and that they are basically on our team and wanting the same successful outcomes that we want. So I think it starts, I think it's multifaceted, and I think it starts with continuing to share our stories. Often in our community, sometimes it can feel daunting because we feel like, is anyone listening? My story is not unique. It's not special, and we feel like our stories don't matter. But we have got to continue to tell our stories and tell them in the physician's office. There's often the discussion around there's not a lot of time with the doctor, maybe 15 minutes, maybe 20 minutes. So how are you having a conversation about your symptoms, sharing your story and the impact on quality of life, plus trying to get a diagnosis and next steps? So that can be hard to manage for a patient, but I would urge us to still continue to do so. We have got to make our health practitioners aware just how much this is impacting our quality of life. I also think for healthcare providers, there needs to be more robust CMEs, continuing medical education around this topic, specifically focused on uterine fibroids and research and diagnosis and treatment options. A lot of times in our community, we hear that, my doctor said that X, was the only option for me. And when we further investigate, X was the only option because that is the only thing that the provider had the expertise on. So not, willing to referral, not willing to offer second opinions with other physicians. So I think CMEs around that, just much more robust conversation around that is education-based, is something that our health providers can be aware of. I also think there needs to be more conversation, clinical guidance, and best practices in our medical schools and with our residents, because I think if they have this evidence-based clinical guidelines, then they're more apt to be aware of the diagnosis, recognize symptoms, and it also helps patients not normalize the symptoms that they're having, because I think that is what's happening a lot of the times, that we're just saying, oh, everybody has a heavy period. I'm a woman, we've been taught that pain is just associated with periods. I just clot when I have my period. And I think we have for so long normalized those things. I think that also goes back to symptoms and medical providers being able to recognize symptoms, so that when patients come and they say it in a very lay way. For example, I remember my first signs of pica. I said to my doctor, I just want ice all the time. So as a patient, I didn't have the clinical verbiage to express that, with every drink I have to have ice in the drink and then another glass with ice. So being able to have providers know those symptom recognition types of things, I think is important. The last thing I'll say is cultural competency and a training around how to speak to different groups about uterine fibroids. I think it's important that we all recognize that not everybody speaks the same way and understands the same way. So I think it's important for our healthcare providers to be able to have that cultural competency, or at least have it in their office, so that when we're speaking to different groups, we are aware of verbiage and lingo and how things are translated, so that we can make sure that we are effectively communicating. And then, this is a buzzword right now, but shared decision-making, I think, is so important, and collaborative care. So from the patient perspective, knowing that you are the CEO of your body, I always say it, and nobody knows your body like you do, but also respecting that the physician has the expertise, has gone through a level of training that as a patient you don't have. Marrying those two so that we have collaborative care and shared decision-making. So I hope that answers your question, just about some of the things that healthcare providers can be doing, along with the collaboration of patients, to ensure that we're getting the best health outcomes.
No, that absolutely answers my question. I have some comments to it, but I want to invite Nisha to make any comments that she might have first.
Sure. I mean, Tanika definitely hit the nose with that. And, just wanted to, echo that, our legislation carves out a portion of the funding for provider and public education, which would further help providers and patients be aware of fibroids and their treatment options. But, there is a bigger need to have a larger conversation around the needs of women of color, and encouraging education to providers on culturally competent care. Just because, I think women of color do get penalized when they do go to get care and service and find out what's going on. Why am I in pain? They're like, oh, you're dramatic, or, it's just a period. You're like, women get discriminated for that in a way. And I think having more culturally competent education, resources, and just trainings to the providers, so that way they can deliver that care with, the with the expertise that they're supposed to, and also making the women feel comfortable sharing, like, hey, I'm having this kind of pain. Is this normal? I'm not thinking this up, right? Kind of thing. And not just feeling more welcome to go to the doctor and raise these concerns. Also, I think in terms of policy, yes, we need more funding so that we can disseminate this information and train more providers that have information, but it also boils down to, daily conversations that you have with your colleagues, your peers, your family, your friends. I think that is also a way of disseminating information for free. If you are experiencing fibroids, if you are experiencing some sort of pain, sharing your stories, that way more women are aware and they know what to ask when they go to their providers. And, sharing those stories is also life-saving because, like we said, a lot of providers aren't really aware that fibroids could be an issue. And, if, like Tanika said, she, her story about, there's misdiagnosis or Sateria, we can learn from those and, ask the right questions and start those conversations of, what should I ask my provider? What steps can I take if they are, blowing me off in a way, not responding to me. So I think just having that cultural competency education within the provider, and also just having more conversations with, people around you that have gone through this, and, don't be shy to say you are going through pain because someone else is also doing the same. And, it's helpful to everyone. But yeah.
You both have really been clear. It's not just the responsibility of one, although we've got to be able to hold our provider community responsible. It's not just, the onus is not just on the woman, but to bring Sateria's words that she mentioned at the top of the hour, women should be commended but not expected to go through pain, right? And beyond that, it is, Nisha, as you've mentioned, what Tanika's mentioned, veritably life-saving. Or at least quality of life preserving to share one's stories. And so I want to ask you both, Tanika, you've actually experienced and are living with fibroids. I'm wondering, at what point in your life, because we've been saying woman, which is associated with a certain age, but at what point in your life did you actually start to understand your body as someone who carries a uterus? Who in your lives have told you about uterine health?
Yeah, I love that question, Mia, because it just brings me back to my childhood and brings me back to the relationship that I have with my mom, and thinking about how she so transparently shared her fibroid journey with me. And it made me, for some time, I thought to myself, this isn't happening to me, not what happened to mommy. But once I recognized that it was happening and that she had gotten through it, it made me understand her journey more, and it made me understand what I did not want for my journey. And I think that was so important for me to recognize, because what it did is it much earlier made me eliminate the stigma, and it caused me to have this confidence and power about sharing my story. Now, there was a period where I was like, nobody wants to hear this. This is gross. You've still been taught.
No pun intended. There was a period. Yeah, I just had to.
What'd you say? I'm sorry, I didn't hear you.
I said I was being silly. I said no pun intended. You said there was a period.
Oh, right. There was, right, pun intended. There was a period where, I felt like nobody cares. I'm not trying to damage my career by talking about this, all the things that, society will tell you is not ladylike or not sophisticated. But I still held on to the fact that my mom shared her story with me, and I saw the way that she struggled, and I saw her desire to have me, My mom's story is so challenged with uterine fibroids, but ultimately she lost sets of twins to fibroids, didn't think she could have children, adopted, and then got pregnant with me just miraculously, and then had to have a hysterectomy after me. So when I think about all of that, I knew that I didn't want women to feel alone in this, because when you're going through any type of reproductive health issue, it's a very lonely place and a very lonely feeling. You feel like you're the only one canceling, you're the only one on the bathroom floor, you're the only one calling out sick from work because of menstrual pain. So I'm so happy you brought that question up, because I think it's important for us to share our stories. Now, not everybody has to do it publicly like, Sateria and I choose to do, but whatever spaces that you're in and whatever family that you constitute as family, share your stories with them, because it's because of my mother and because of her bravery sharing with me that it gave me a better understanding of what my trajectory would be like and what I wanted to create for myself. So while my story has still been challenging as well, there's a certain level of confidence that I have about sharing my story that I owe to my mother. And I think that doesn't just have to be mothers, it can be aunts and policymakers who are willing to share, just like Congresswoman Clarke, who has so eloquently and publicly and transparently shared her battle with fibroids. So I just think we need more of that. We need more of those transparent conversations, because when we see our leaders, both publicly and within our families, do it so eloquently, there's a certain level of confidence that comes with that. And so often in our community, we hear that, my mom didn't talk about this with me until I was being rolled into the operating room. And she says, honey, you're going to be okay. I had this, grandma had this, auntie had this. And, there is something to be said about not wanting to talk about it within the family. But I would just encourage people that we need to talk about it, because being rolled into the operating room and hearing that is not, in my opinion, the ideal time. We need to be conversing about it more so that we have the confidence to share these stories. And when it comes on to policy, allow our lawmakers to know what's happening in our households. And these are your constituents, and there should be a level of care there.
Because it has workforce implications, it has economic implications.
Absolutely.
It has implications potentially even on, as you mentioned, on mental health and all of that. Nisha, as I was listening to Sateria earlier, and as I'm listening to Tanika now, both of them are talking about, have mentioned stigma, right? And the ways in which stories can liberate others from the stigma associated with not being silent, right? You all are choosing a route of warriorship, technically, is what I would say, which is, I'm going to stand and on my story. And this is how we battle stigma. This is how we battle lack of support. Nisha, it's not like we can legislate away stigma, right? It's not like Ms. Clarke, can write a bill to say no one should stigmatize women and then that be the bill, right? But using this bill in particular, right? How is it that people on the call, people who have children, people who may not be active as advocates, but are curious about how they can get involved, how can they uplift this bill such that ultimately stigma will be passed?
Yeah, no, great question. I think everyone that's listening in, that's not working in Congress, I think, even if you are working in Congress, I think, picking up the phone and calling your member of Congress or emailing them and encouraging them to co-sponsor our bill. And if also you could do it on the Senate side, we have Senator Booker and Capito who have introduced it on the Senate as well. So, just encouraging your members of Congress and senators to co-sponsor this bill and support it. Because the more support and more co-sponsors we get, the higher chance that we can, move this forward and pass it through Congress. And I think just, building more support and loudness on the ground, and that's going to the leadership and legislators always has proven to, make an impact. So I think, even if we aren't able to pass this Congress, I think just being in the forefront every single year that more and more that we need to pass this. And I think we're getting there. And I think encouraging and reaching out to your members of Congress and telling them to co-sponsor is the best way to support this legislation and to support the work that, the White Dress Project, the Fibroid Foundation, Hologic, everyone's doing to create awareness to fibroids.
And to build on that, I don't think it's an exaggeration to also make the point that uterine fibroids, that uterine health in general also implicates our nation's security, right? When we're talking about, and this doesn't get much attention, but fibroids are actually an important military readiness concern, right? Are there things that we can do well, first of all, before we even talk about a policy perspective, are there ways that we can help to socialize people to the issue of military readiness and women's health overall, and specifically uterine health? And then are there ways that we can, from a policy perspective, help to address the challenges that women with health issues face in the workplace or in the military broadly?
Yeah, so I think, like we said, all women, if you have a uterus, you can deal with fibroids, and that doesn't discount you if you are serving, in our military. So I think that's a big, in terms of military being a very predominantly male, we're still dealing with, women trying to make their, footing there, and having fibroids is something that, they struggle with on a daily basis. I think in that way, we need to fund research. Example, our bill, just starting there is, funding research, creating, once we fund that research, we are able to have a database and that information of what uterine fibroids are, what are the best treatment possibilities, like, maybe, 10 years from now, there's a pill you can just take and it just reduces the fibroids. We don't know. And I think we won't know until we have that research and we fund that research. The other thing I would like to say is, strengthening for women that are working in offices or just in the workplace. Strengthening our medical leave policies to, adhere to women facing health issues, whether that any kind of reproductive health, but just strengthening those medical leave policies that, if you physically cannot come in due to fibroids, you have that option. You're not being penalized from work. You don't have that fear of repercussion that, if I come in, my boss is going to fire me, or, feeling that you can't, you have to show up even when you're dying in pain. I think that's very important and something that we need to work on. And lastly, I would say is, providing access to reproductive health overseas, whether that includes, abortion access, whether that includes, more OBGYNs resources overseas, or providing, menstrual resources such as like tampon pads or, sanitary products there. I think that is something, or even just like provide like, uniforms that are compliant or that can be helpful for women that are going through fibroids, and that way, or extra, or however they need it, just so they can feel comfortable while they're working in the military, and that they're not going to be discharged or feel like they're penalized as well, just for having, their own health issues, and also not feeling that they have to share in a predominantly male environment, like, hey, this is something I'm going through, but that's their prerogative if they don't want to. I think in terms of obviously funding, we need to provide more resources and, just providing more medical leave. And that way women feel comfortable and they can own it and, not feel like they have to hide that they're going through something, and just feel empowered.
You're talking about very comprehensive, just interventions here. We're not talking about rocket science. We're really just talking about listening to women when they speak to their pain, to women listening to their bodies and being very mindful and vocal about what they're experiencing, to policymakers making certain that they're paying attention to constituents and the ways in which uterine health impacts the workforce and economic wellness of their district or of their state. We're talking obviously about mental health. We're talking, Tanika, even about the ways that we're communicating openly and culturally appropriately, but still, you're a journalist by training, Tanika. And I'm wondering if you can speak to what sort of successes as well as challenges that you have seen in your work, even beyond the White Dress Project, as you're uplifting the awareness around uterine fibroids.
Yeah, thank you for that question, Mia. I've experienced quite a bit of challenge as a journalist. I believe that I have the strategies and the tools that make that I can recognize a good story, let's say. And I think a lot of times we categorize stories in good, bad, impactful, unique, all of those things. And some of the challenges that I've faced around sharing a reproductive health stories is that it makes people uncomfortable, right? We shouldn't be talking about issues below the belt. We shouldn't be talking about periods. We shouldn't be talking about pain, what happens in a uterus, what a woman wants as her outcome. And I found that very challenging because 50% of our population is enduring this and can have some reference to it. And I also know that a woman within a family, a lot of times is the nucleus of that family, right? And someone who is the brains, I would argue, behind the family unit, right? So, and that's not to discredit, obviously, what our male counterparts bring to the family, but specifically talking about the role of a woman and her importance in the family. So when all of those things are discombobulated, I'll say, and a woman is not able to share, or her story is not deemed important, or her voice is not deemed vital to the conversation, it becomes very challenging. And I think oftentimes this conversation is uncomfortable for men. And because it's uncomfortable for men, then somehow we have moved away from the importance of the story. So even as a journalist, I often am asking, why can't we share this story more? Why does it have to be only a certain type of story that is told around reproductive health? And I, even as a journalist, it's still my constant fight, but I can only speak from what I think we can do moving forward, which is continue to share. And it sounds redundant. It sounds like not a good strategy potentially, because if we continue to share and nothing's happening, then, what's the point? But if we continue to share, then the tide will change. And I have seen it change in the time that I have started the White Dress Project. I have seen that we're having more conversations like Hologic is hosting, and Hologic being a great partner and advocate in this work. And I have seen more members of Congress, specifically men, speak to what their constituents have talked about and speak to what is even happening in their own households. So it's I'm beating a dead horse, but I feel like we still have to continue to share our stories, because not only does it eliminate the stigma, but it makes it a natural conversational topic that we all should be talking about. So as a journalist, just to wrap up, as a journalist, I feel like if we continue to share our stories and we continue to show different angles, we not only show the impact on our physical health, right, but show the impact on our mental health, show the impacts on our military, show the economic burden and the financial burden that we have that is not only on women, but on the family. Show the social and relational impact that it has on relationships. Show the policy impact. I think it's talking about how this can impact the entire woman, the entire society, and it's not just about a woman bleeding heavily, right? It's not just about a woman's pain, because unfortunately, I think when we just categorize it that way, then it becomes not my problem, move it on to the next. And it doesn't become an issue that we can all converse about. So I really think that if we start to look at CEOs and say, hey, this is how this is impacting your workforce, what can we implement that will better serve your better serve your workforce, because these are the stories that we're hearing. So I think, long story short, I think it comes back down to the stories that we are telling, because if we're not sharing our stories, then we don't have the data, the anecdotal data. And I feel like anecdotal data is queen. It is what we need to ensure that people are understanding how this gravely impacts our quality of life. And I love that ACOG, I believe it's ACOG, don't quote me on that, but ACOG just changed its guidelines around what is considered normal and what is considered a normal period. And now it's something to the effect of, if you as a patient feel like it's impacting your quality of life, it's not normal. So speak up about it, let your health practitioners know. And I think that is something that we can applaud, and a step forward that says, hey, let's own some of this, and let's speak up that if you don't feel normal or this is impacting your quality of life, say something. And I don't think we only need to do that in the physician's office. I think we need to do that in every sector that we intersect with to show the impact. So that was a long way of saying, speak up, tell your story.
and it's so thorough. And so I'm going to make a comment and ask Nisha a question, but I want to invite the audience, if you do have questions that you'd like to be addressed in these last moments of the webinar, please make certain to submit them, and we'll be sure to field them. You talked about telling the story, right? And we've been talking about telling the story, whether it's in the provider's office, as you've mentioned, or in a congressional office. And I can truly appreciate the point that you're making about, so initially you both were talking about cultural competency, which really is just another way of saying, making sure that the practice meets the patient's story, right? And the patient's experience. And then the other way around that is ensuring that the story we're telling is connecting with the people we're trying to have as an audience, right? So for those of you who are thinking about, okay, well, the bill is the bill that Miss Clarke is champion of, and that Nisha is here talking to us about today, is a bill that is named for a tremendous member of Congress who just happened to have been a Democrat, right? And so the story that she told around this, sometimes people will say, well, this is a Democratic story, but it's little d Democratic story, right? In the sense that it impacts everyone. So Nisha, for those who are considering, well, how do I talk to Republicans about uterine fibroids? What's that story to be told? What are some ways that you would encourage them? How do you work with your counterparts across the aisle? How do you work with your counterparts even across the street and the Senate to get this done? And Tanika, I'm going to give you the same question as an advocate. How do you speak with so many different partners in this space such that the story touches them and draws them into the narrative?
Yeah, no, thanks for that question. I think, in this political climate that we are at, it's a very unusual one. When Congresswoman Stephanie Tubbs Jones first introduced it back in the 110th Congress, I mean, it was a different time and different story, and we were more malleable to working together or on the other side of the aisle. I think in this climate, it's not impossible. It's definitely possible, but I think, people are forgetting, especially, that this is an issue that affects anyone that's a human being. It's a human issue. This is not something that can be politicized or can be put up for, messaging or, up for grabs where, we're just going to make a lesson out of it. Or, I think this is a real issue that women face on a daily basis. And it's not something that you can just push to the side. The longer we delay this, the longer we don't pass this or provide the funding to it, more and more women are in dangerous harm, and we need to make sure that we're giving them the proper care that they deserve. In terms of working with, my Republican counterparts and, having those conversations, I definitely reinforce with them, this is an issue that's not only affecting, yes, Black women are predominantly affected by it at a higher rate, but, white women, Latina, Asian, they're also affected by this, which your constituency is composed of, but I think even just also relating to them that, if they have a wife or, they have children or, just on their own familial level, that this is something that can be impacted to them as well. And, kind of bringing it to more of a human level. That's definitely been more responsive in terms of getting more support, but we still need bipartisan support to pass this bill. Last Congress we had about 132 co-sponsors, which is great, all Democrat, but we also do need Republican support because this is an issue. It's a bipartisan issue. It's not something that just affects one party. So I think encouraging, even if you're hearing it here and your member of Congress is Republican, please relay that message to them and, encourage them that they need to co-sponsor this bill.
Yeah, I agree with that wholeheartedly. I think we need to make this extremely personal. It's vital for our members of Congress to see how this potentially could be impacting their household, right? And I think everyone wants to know, how does this impact my life, right? As much as our members of Congress want to say they are for the people and for everyone, I think a lot of times it is much more impactful if we can show how this impacts the person in your house, right? So I have often said, Senator, Congress member, this is how it impacts your wife. This is potentially why your daughter is coming home from college and saying she can't finish the last semester. This is why your wife is potentially having painful sex. I think we have to be candid about it, and we have to not shy away from the real things that are happening, because painful sex with fibroids is a thing, right? This is why your wife is eating all the ice in the ice maker. We have to give those very real scenarios.
That'll bring them to the table quickly.
What'd you say, Mia?
That'll bring them to the table quickly. You should just lead with that at all times. Just lead with it.
Exactly.
Yes.
And I feel like, sometimes, am I too outlandish? Is it am I saying it wrong? But I really think that's what we have to do. We have to show them, sir, this is why your ice maker is broken all the time, because your wife is, whatever. There are things that are happening in the home with their constituents that they're not making the connection to. And I think that if we're not transparent about it, and if we're not candid about the things that are happening, especially the mental health component, especially, I used to always say, that walking into a boardroom for me was like the biggest fear of mine when I was on my period, or not knowing when my period was going to come and having to present or having to have a big executive meeting. That was one of my biggest fears, not climbing a corporate ladder, not, any of those things, but just having these board meetings. And I think if our male counterparts aren't aware of those types of anxieties or those scenarios, then they don't know the grave impact of this. So I really think, to Nisha's point, making this something that they can connect to their household. And then maybe if they connect it to the household, then it kind of ripple effects to their community, to their constituents, to their district, to their region, and then they can become an ally that way. But I really believe that it has to start with, Senator, this is potentially why your wife is having XY issue. This is potentially why your mom didn't have any more children. And speaking very
XX issue as opposed to XY issue, but yes.
Exactly. Yes. Thank you, Mia. But being very, very candid about that, I think is one of the ways to make sure that this issue is something that is relevant to them.
That's it. It's right there. It's the human, the human connection there. That's why this bill is so important. That's why this issue is such a unifier in a lot of ways. And really look forward, so there are questions in the chat. One of them I'll elevate, and perhaps if you all have information, you can drop it in the chat for them as we bring Sateria back into this conversation. But there's a conversation about, or an ask about, are there studies that demonstrate the economic impact, the workforce impact of uterine fibroids on the economic wellness of people? And so if you all know of those, you can drop them in the chat. If not, we can always follow up on the back end to the person who asked that question. I think there are certainly studies, but I don't have them off the top of my head. But another question to hold in mind is, how can we bring this to providers in a different way? We touched on it very briefly on the beginning. So just hold that in your mind in terms of really communicating the message, like the providers of the nation, of the world, have a very unique opportunity to intervene and to ensure that patients are listened to, that their pain associated with fibroids is not discounted. And so if you'd like to respond in the chat to that question, I encourage you panelists too. But I want to invite Sateria to give us some closing remarks.
Thank you, Mia.
Welcome back, Sateria.
Thank you. This has been such an empowering and informative conversation. Nisha, Tanika, Mia, it's been great to hear your thoughts, and I wholeheartedly agree. It gave me a number of thoughts before I invite everyone to reach out to their members of Congress. There's another major women's health concern that has gotten significant funding, and I'm so glad that it has. And as you were speaking, I thought that the attention given to that health concern is because a relative of someone with that health concern sat at the head of the Senate Finance Committee. And so as we are looking at funding fibroids, which again impact 26 million women and menstruators in the US, I invite you to ask the women and menstruators in your life if they've been impacted by fibroids. Whenever I invite people to have that conversation privately, they come back, as has been referenced in the conversation here, and say, oh my goodness, I didn't know my mom had a hysterectomy due to fibroids. I didn't know my sister was currently struggling with fibroids. And it really personalizes the issue. Also, whenever we advocate on Capitol Hill, we're always asked, who in my district is affected by this? Why would I vote for this? So your voice matters. You may feel that your voice doesn't matter, but it absolutely does, because your members of Congress want to hear directly from you to know that if they invest time and resources in the passage of this particular act, that someone who lives in their actual district will be positively impacted. And so your voice has tremendous power in that regard, and we encourage you to reach out. And then on to end with hopefully a little bit of a giggle, It's been in the news lately about a period machine. It goes from scale 0 to 10. Men were hooked up to it and got to about level 2 on average, where the typical range for women where they said, okay, this is my normal, was 8 to 10. So let's just park it there and keep that in mind. And I again invite you to please think of women's quality of life, reach out to those you care about, and raise your voice in your districts at home. And I just want to thank all of the panelists and me and the Hologic team for having me today.
It's certainly been our pleasure. You know, I can't thank you all enough. Thank you for your time. Thank you foremost even for your advocacy and for sharing your stories. I encourage you to just stay in community with one another. It's not easy to do the work that you're doing, and it goes without saying, but I'll say it anyway. We need you. We appreciate you. For those in the audience, if you've not yet, as Sateria mentioned, called your member of Congress, please make certain to do so, to ask them where they stand on the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. And if they have questions, they can call their member in the House, Congresswoman Clarke. They can call their member in the Senate, or excuse me, their senator in the Senate, Senator Cory Booker, who's working with his colleagues. I want to end by thanking Nisha Thanawala, who is our resident representative of Yvette Clarke as her senior policy advisor. Thank you, Nisha, for coming.
Thank you for having me. Thanks for this informative. Yes. I learned some stuff even working on it every day.
Good. Please give our appreciation to the Congresswoman as well. We really appreciate Tanika Valbrun being here of the White Dress Project. Tanika, thank you so much for your story and the way that you show up in this world. For sure.
Thank you, Mia.
No doubt. No doubt. Sateria, thank you for opening and closing for us of the Fibroid Foundation. You all are doing a lot right now, as it is Uterine Fibroid Month between both organizations. And for those in the audience who want to learn more, I encourage you to go to the websites and be engaged to the extent that you can for the remainder of what do we have, 6 more days left in July, right? And even beyond. Once again, I'm Mia Keeys, Federal Affairs Director from Hologic, and we are very excited to stay in touch with you. If you have questions, feel free to reach out. And thank you so much. Talk to you again another time.